My dentist is on the phone, Dr. Trembley. It's also Amy's dentist, Dr. Trembley. It's also my wife's dentist, Dr. Trembley. We love Dr. Trembley. That's why we trust him to bring him on for hard-hitting questions for a dentist. Dr. Trembley, good morning.
Hi, Bobby. Hi, Amy. Hey, crew. How's it going?
We are great. We have a lot of questions. These may seem dumb to a extremely educated dentist that does high-quality work like yourself, but please humor us, Dr. Trembley.
All right.
All right, number one. Why do people get cavities later in life if they've never had them and they haven't started eating a bunch of sugar or stuff as they get older?
Maybe, well, there are a few reasons, but the saliva in your mouth usually decreases in volume with age, and that helps buffer acid. Acidity is why we get cavities on the teeth. So if you're getting cavities later in life, it's because you have more acidity in your mouth. And usually our saliva content decreases as we age.
So you can be doing the same exact thing, but because you have less spit, it's not fighting like it did when you were younger. Oh.
Is there anything we can do to generate more saliva?
Yes, it's kind of a long answer, but there are products, but more importantly, there are products that change the pH in the mouth, like rinses and toothpaste. And you know what? I'll send you guys a little info about that you guys could talk about sometime.
I don't know that we'll ever break into that segment, but I think that's good. The cavity thing was good to know.
I'm pushing it.
I'm pushing it. There is a cavity conspiracy on TikTok where these people will get on and go, went to the dentist, and they said I had 11 cavities. I went to a different dentist, and they're like, no, you're totally clear. Is there in the dental world, are there
quotas?
Or bad dentists that are just telling people they have cavities so they can make money?
You know, I don't think there are a lot of dentists who are actually trying to overdiagnose to make money. The issue with this, because I get this question a lot, is you're going to get different treatment plans from different dentists because it's a subjective thing. Meaning, when we take x-rays, if the tooth is white, that means it's healthy. If it's got a big dark area in it, it means it's got a cavity. But then there are different shades of gray, and one dentist may choose to not treat that one and wait and see, whereas another dentist may decide to treat all of them based on their experience. So I don't think there's a conspiracy of dentists trying to make more money by diagnosing more. And on the other side of that, it may be more of a liability to not treat any of them, and you should have listened to the first guy. So AI is coming out to fix this, where it's going to standardize when a cavity should be filled and not filled.
You're telling me people on TikTok are just saying crap for clicks? No way, Dr. Tremblay.
Well, no, I do think you would get a different treatment plan based on different dentists that you go to. So I may recommend 4 fillings. The guy down the street may recommend 6. That makes me look good. Meaning, you're just going to get different opinions on different x-rays, but I don't think there's a big dental conspiracy of us trying to get more money from fillings, because it's not the most pleasant work for us to do.
How often should people replace their toothbrushes?
As soon as it starts fraying and losing its structure.
When the bristles are out.
My bristles are at this point, they're all to the side.
Yeah, that's not good.
Yeah. Oh, crap. Oh, so as soon as it frays, it's time to get a new one.
I would do probably 4 or 5 a year, 3 or 4 or 5 a year.
Wow. What about, I'm assuming electric toothbrushes are better because they actually do the work. Is that true?
Right. I think they are because of, I use both, but I like how they have that ultrasonic head, and all you have to do is hold it to the teeth. So, and it tends not to overbrush the tissue. A lot of patients will overbrush and cause wear on the teeth, and we tend not to have that as much with electric toothbrushes.
Can you tell when people come in and they haven't flossed or really taken great care, but they went hard, they went to town on their mouth right before they came in? You can tell, right?
Well, I could see when there's acute inflammation from irritation of the tissue, but I can't always tell when people aren't flossing because different people accumulate buildup at different rates. So, and to be honest, I'm telling you guys, I don't think in those terms. I don't think of oh, I could tell he hasn't been flossing, or maybe my hygienists do, but it's not always apparent. But we can tell when the gums are really irritated. So if you're in the car flossing real hard before the appointment, we can usually see that. Yes.
Has anybody ever cursed at you because it hurt worse than they thought?
Cursed? Oh, I'm sure. Yeah.
Yeah, just like
certainly.
Dr. Trembley, F. Like
Yeah. Oh, yeah.
Yeah.
I haven't been cursed at very much, but I've heard curse words flung around before.
Let's say if I wanted to get a diamond in one of my teeth, and I was like, Dr. Trembley, we've been together for years, because we have, and I really have been saving up. I got this diamond. It's super important to me. I want to put it in my front. How would I do that, and would you try to talk me out of it?
No, I would do it for you, because we can. What we do is we would take the diamond and we would etch the tooth, and then we would drop it in a liquid resin that's kind of clear. So it's not sitting inside of your tooth. It's actually just sitting on the outside of it. And as long as the diamond wasn't too big, I would happily do it, because I could place it and then remove it without really damaging your teeth. Now, I would feel comfortable doing it, and I know that they have people doing this who aren't dental professionals, and that can get iffy. But yeah, I would have no problem doing it. If you have a diamond, Bobby, and you want me to put it in one of your teeth, I would do it.
Dude, so I'm in.
How secure is it though? Because like if you eat an apple, does a diamond just fall right off?
Great point. Great question.
Well, so when you think when you think about what we're doing with the resin, which is what would hold the diamond, the resin, we put the blue light on it. Everybody hears us click the blue light. That sets the resin and locks that diamond in place. So we're not actually, because we're not putting it into the tooth, we're actually putting it into a material that's attached to the tooth. That bond and that connection is quite strong. And of course they could come off or it could be dislodged, but it's, if it's done right, I could get that diamond in there and you can eat all the apples you want.
That's what I want to do.
Not gonna come off.
That was my goal as a kid, get a diamond in my tooth and eat tons of apples.
Are people using real diamonds or fake ones? Because, it seems like if you have a real one, you could easily swallow it and then, that's money gone.
Have you ever put a diamond in a tooth, though, Dr. Trembley?
I did it I did it it's funny. I put a temporary on a patient last week, and she brought a little diamond because she wanted me to set it inside the temporary, and I did it. It took about 30 seconds. So kind of fun.
It real?
I have to do this.
You should totally.
Even for a bit.
I assumed it wasn't real. It looked real. I mean, it looked nice. It was very small. I don't know how to rate how big diamonds are, but just a little tiny diamond. And so I took my forceps and dropped it in the resin, cured it, polished it.
Mine will not be cubic zirconia. When I do mine,
it's going to be real.
Yeah, it's going to be as real as possible. We can go to the pawn shop and have them look at it and examine it. 3 final questions. Question number 1, Dr. Trembley. I clench hard, as we know, and you have put Botox into my forehead, my temples, into my forehead, and into my, what's it called, mandible?
Masseters.
Yeah.
Jaw.
Yep, masseters.
Yeah. And so when that happens, do I look sexier to people because of, like, am I also getting the benefit of why the Real Housewives would use Botox? Like, is it like a double benefit?
That's a great question. So what Botox does is it decreases muscle activity. And when we place it, the two muscles that close, that are responsible for clenching are the temporalis, which is on the side of the head, and then your masseter right there by your jaw. And these muscles, just like any other muscle, skeletal muscle, is if you're using it a lot, it's going to grow. It's going to get stronger. And when we inject the Botox, it's going to decrease that activity. So there will be some attrition of the muscle, just like if you were doing arm curls every day and then you stopped all of a sudden, that muscle would shrink, it would atrophy. And the same thing happens in the jaw. You can see patients who have like almost a very square jaw, who are big clenchers. When we give the Botox, that slims the face down slightly as that muscle shrinks.
And I have broken, I believe, 6 teeth, and Dr. Tremblay's fixed every one of them. And when I go in, I'm not lying about this. I've had Botox into my jaw here and in my temples here. How often can I get that? Can I come like every week to get that?
No.
You know, what I use the Botox as a tool in the arsenal, and it's a great tool to have. And in a very narrow range of cases, it really helps people as the final treatment. But in other cases, we're treating a symptom of something else with the Botox. So I don't want to be doing this long term for patients, but you can get it about 4 times a year. And I try not to exceed four treatments of that, because I think there's something else going on as to why you may be clenching and grinding.
Yeah, he told me to go to therapy. And I was like, already there, Dr. Tremblay. He was like, are you seeing a therapist? I was like, I sure am. Okay, 2 final questions. Because I do clench so hard, I lost my mouth guard before Christmas. I don't know, I lost it or a dog ate it or something. How quickly now can you, if I go in, and I've done this, it's been quicker like every time, but now I go in, you put the thing on my mouth, how quickly until I can get that mouth guard again?
An hour.
That's crazy. It used to be days.
Yeah.
Yeah. Well, the reason is in dentistry, we're having so many advancements. And so right now we would take a scan of your teeth. We'll put it in our software, and AI is designing it. And we have printers now that are printing this material. And the benefit of this is that, now we can generate these quickly, and they fit very predictably. And so it's taken something that was had to be sent out to a lab and adjusted, and now it's just very low stress and can be, some patients need a new night guard every year because they're just wearing through it. And so now the stress of the night guards is gone way down because we can produce them quickly and reliably, and it's great.
I know he's got patience to do. He's not a patient right now. So,
He's working.
Okay, so 1.5 questions left. The quick question that I ask every single time that I want people to hear: flossing versus using those pick flosses. What's the difference? Can you just do pick flosses and that's okay?
I think the pick flosses are great because people tend to use them more often. But the downside of that is if you have like an overhanging filling and you put that pick floss in, and you're having a tough time getting it out, then the benefit of the floss is you can pull it straight through. You don't have to pop it back up. Whereas with the pick floss, you have to pop it down and pop it back up. So I think it's great. If people are using the pick floss correctly, then that's great. But if they're not, it tends to, people can damage part of the teeth and saw it back and forth. Because you can't release it by pulling it through, that's really the downside of it.
Last question. I want to save it for last, but did you get jumped by a homeless guy?
Did I?
Yeah.
Oh man. Yeah. Wow. Yeah. That's a crazy story.
Yeah. Give it to me.
At the park.
Yeah.
I was out at the park throwing the Frisbee for my dog, and some guy punched me in the face while my daughter was right under me. Yeah. Some guy came up and assaulted me in the park.
Why?
With my daughter.
Random.
I have no idea. Still don't know.
Did he take money or anything?
Yeah. What?
No.
He just wanted to get a good punch?
Well, I have no idea.
I'm going to say this.
Assume...
In defense of the homeless guy, Dr. Trembley's really good looking, and you can get really annoyed.
He's jealous.
Oh, yeah, for sure. He comes in his because he's got his dental suit is cool too. It's not like a normal dentist. He comes in, he's looking all in shape. He's got a great face. He's wearing a little dental hat that looks cool. And so, you know what? I want to take a couple shots in the chair too. I didn't, but I thought about it a couple times. But
yeah, nobody would have heard about it had my daughter not been right there. I mean, the guy almost stepped between me and my daughter to do this. That's what was so shocking.
And how did you react? Just make sure your daughter was safe?
Well, yeah, I pushed her out of the way, and he kept coming at me, and I didn't want to escalate it. I just wanted to stay between my family and him, and that's what I did. He eventually lost interest, but it was just
teeth
the wildest
out?
thing.
Oh, teeth. What if you? Yeah.
Well, there was that moment where I was thinking of elevating it and going blow to blow with him. But I'm actually glad I didn't, because I just kept pushing him away as if I was, a basketball player trying to stay between the guy trying to score in the basket. I was trying to stay between him and my family, and he lost interest and just walked off. So it turned out great, but it was a bit traumatizing to me, because I don't know if many dads have been, assaulted with their children right there at their feet for no reason. It was wild, but I'm okay. Everybody's good.
America's Dentist, Dr. Jeff Trembley.
Yeah.
SmileOnNashville.com is his website. Thank you for all. We love having you on the show a couple times a year. Thank you for the time, and we'll let you get back to work, and hope you have a great rest of the day, Dr. Trembley.
Thanks so much, guys. Happy 2025.
All right. See you.
It's a Bobby Bones show.